Hey, you're,
Yeah.
okay.
Anytime's good with me.
All right, we will go ahead and get started. Since it is 11:30, we have more registered, so we'll let them kind of trickle in as they get here. But welcome to the Polk County Emergency Operations Center. My name is Brett McIntyre with Polk County Emergency Management, in charge of our training and exercise portions of our program. We host these lunch and learns basically every month on different topics, and today is going to be on CPR and cardiac emergency response planning with the Iowa Heart Foundation. And Leslie here, well, let her do the introduction here in just a little bit, but I'm gonna give you kind of the layout of our EOC before we get started. We do have coffee available here on the side of the room right next to our AED that we'll hear more about as we go through today. If you would like water, you can go right through the back door here into our break room. On the back side of the break room in the hallway, there is a water bottle refilling station there. If you need to use the restroom today, you can go right back out the way you came, hang a left, and then a second left, and they are right on the backside of these two conference rooms here, C13 and C14. Right on the backside of that's where you'll find our bathrooms. We don't expect any severe weather today, but if we did need to seek shelter in our basement for whatever reason, you go back out the same way toward the bathrooms and follow the signs, kind of wander your way back through a little bit of a maze of a hallway, but it is labeled. If we have to evacuate the EOC for any reason today, easiest exit is right out the way you came, back out those doors into the parking lot. If for whatever reason we could not go that way, we go out to the side here through public health and out the south side of the building. So that's what we have for the layout of our building today. I want to thank all of you for joining us. I'm going to turn it over to Leslie now. Let her get started, and I'll have a few more things to wrap up at the very end, but thank you for being here today.
Good. Thanks, Brett. Hi, guys.
Hello.
Oh, come on. I don't know. It's not Monday. We're gonna be rolling into the week. Okay. We all going good? Yes. Yeah. Okay. So, this is gonna be interactive. We're gonna be doing things, talking. You can interrupt and ask questions completely fine. As you make your way to your seat, if you could fill out the before side, I think something should be on top, but they did it down correctly. If you need a pen, let me know. We've got some. Okay, good. We've got, no. Can't promise it'll work. Just kidding. We normally when I hand out pens, there are at least 2 or 3 that don't work. If anybody else needs one, let me know. So I am Leslie Mesta with the Iowa Heart Foundation, and I always like to start with that we are not the American Heart Association. Sometimes people confuse us with that. We are a local health and human service nonprofit that were started by the cardiologists at Iowa Heart Center over 30 years ago. So we are a completely separate 501c3 health and human service nonprofit. All the money that we raise in Iowa stays in Iowa, and we provide heart health education like today and heart disease prevention. Okay. So who we are really working to be the leader in the promotion of cardiovascular health in our state. As I said, we focus on that heart disease prevention and heart health education. We also provide the management services for the American College of Cardiology. So that professional member organization for those providing cardiovascular care in our state, we provide the management services for them as well. So how do we do the work? Community outreach like this. We also have our promising prevention programs and clinical education support. We have our cardiovascular today coming up in February. So it's the first Saturday in February. So if you need any continuing education in that healthcare space, that would be a great opportunity to do that. We partner with schools, churches, libraries, other community-based organizations to provide that education. You'll hear about our AED donation and placement program, but we also donate classroom kits to schools so they can receive stethoscopes, heart models, our heart squeeze, all 6 lesson plans, all of that we provide free to those schools in our state that register. We also today, one of my colleagues is over in Cedar Rapids doing kind of that careers in cardiology and career fair. So lots of outreach into the community about how you can support your health and your heart health in specific. So today we're going to focus on sudden cardiac arrest and response to that. Did anyone know that October is Sudden Cardiac Arrest Awareness Month? Now you do. There's also that first week in July is CPR Awareness Week, but October is Sudden Cardiac Arrest Awareness Month, so it's a great time to be talking about this. It's a significant portion of the population that is impacted by this, right? Over 350,000 out of hospital cardiac arrests happen every year. And right now, the survival rates are not high. So that's why we do this education, so we can increase those odds of survival. 1 in 10, that 10% on that previous screen, 1 in 10 currently are surviving. Now, if we can get bystander CPR to occur and using the AEDs, it has been seen that we can increase that up to 50%. That's significant, right? 7 out of 10 of those cardiac arrests out of the hospital happen at home. Most people don't realize that. So this could be someone you know and love that you might have to provide CPR to. So it's critical that we all know how to do CPR. So this is my why. This is why I teach it. If you look at that picture in the middle, that's my super handsome 14-year-old son. And then the picture on your left is really how it started. He was 10 pounds, 2 ounces, ginormous baby, and very sick when he was born. And he ended up in NICU he had newborn pulmonary hypertension. And because of that, they did all kinds of tests, and those tests showed us that he had quite literally a big heart. He has a heart disease, a disease of the heart muscle that is called hypertrophic cardiomyopathy, and it puts him at risk for cardiac arrest. So the picture on your right is him doing one of his tests. He does an exercise stress test and a stress echo to really make sure that the medicine that he takes is doing its job and the slow his heart down to make it not work as hard and to try to prevent those abnormal arrhythmias that could put him into cardiac arrest. So I teach CPR because I'm not with him right now, and I sure hope that anybody that's with him would try to save him. And so I educate everyone because it might be your son or your daughter or your mom or your dad that you need someone to save. So I'm really here just to share my why and for you to identify who your why might be and how we can spread this information. So a couple things. This is not a certified class. If you were hoping to come here and be certified in CPR, today is not that class. That class is usually at least 4 hours long. It involves working on rescue breaths and has a whole host of other criteria that we're going to go over. But hands-only CPR is still shown and proven to save lives. And what we found, especially during the pandemic and even since then, is that people weren't willing to provide those rescue breaths, that mouth to mouth. And so then we saw bystander CPR rates go down even worse than they were. So we're here to educate you on how to do hands-only CPR, what you might be comfortable doing, right? Hoping that you could do that. And really encouraging you to start there. If you feel the need and desire to become fully certified in CPR, to learn those rescue breaths and the techniques, let me know, and we can connect you to those organizations that provide that too. Our hands-only CPR classes that we provide are free. The certified classes typically have a cost associated with them. So we go out and provide these in the community to, like I said, churches, schools, organizations that invite us in to do that. So that's what we're going to be focusing on today, is that hands-only CPR versus the certified. So to define it a little bit, CPR is that cardiopulmonary resuscitation. It's when you're pushing and providing those compressions and giving the rescue breaths. The AED, so the one that's over there, and then I have our trainer up here and we're going to go over it. That's the automated external defibrillator. That's going to be providing that shock after that rhythm has been analyzed, if a shock is warranted. So it's the little machine that's going to shock that heart, okay? SCA is sudden cardiac arrest, and that is an emergency when the heart stops beating normally. It gets out of rhythm, okay? Now, a heart attack, which you might hear called an MI, which is a myocardial infarction, that is different than cardiac arrest. They're two very clinically different things, okay? So we're going to go over a little bit of the difference here. So sudden cardiac arrest is an electrical problem in the heart. A heart attack is typically a plumbing problem in the heart, okay? So did everyone know we had electricity and plumbing in the heart? Got both, right? Okay. So a heart attack victim is going to be responsive, typically breathing, and they don't need CPR. Okay, they might be able to tell you that they have chest pain, tell you some symptoms, right? They're responsive. A sudden cardiac arrest victim is unresponsive. They're not breathing normally. And when we say that, you may see someone that has gone into cardiac arrest, and it might almost look like they're almost like gasping. They're not breathing normally, okay? And they will need that CPR if they're unresponsive, all right? Those are the two differences there, responsive versus unresponsive. As I said, sudden cardiac arrest is an emergency. Now, someone may have a heart attack, and that might lead to cardiac arrest, but they are two clinically different things, okay? So we need to be treated with a defibrillator. And I say that, and that's why we incorporate that AED training into ours, because when you do these compressions, you're doing the pumping part for them, right? So you're putting the compressions, you're pumping and circulating the blood, okay? But that person in cardiac arrest, that is really helping to buy them time until we can get their heart back into its normal rhythm. Okay, so CPR is critical, but calling 911 to get the emergency help there and locating that AED, that's what's typically going to take to get that person back into that normal rhythm. Okay, so CPR is critical. The AED is that next step to get them back into the heart's normal rhythm. Okay, and really with every passing minute, we're decreasing their chance of survival. So we have to start it right away. Within 4 minutes, brain damage can start to occur. All right, so critical to get these steps started right away. So we've talked about this a little bit, but those acronyms, I always like to make sure people know. CPR is the compressions, right, and those rescue breaths. The AED is the shock that's happening. Sound good? So how does that AED work? It is designed to be used by anyone. Okay, it will tell you exactly what to do. It will talk to you. Some of them have English or Spanish if you need to switch to Spanish language. There are ones, when you have here, I'm trying to think of it. Some of them have pictures right on the screen as well. So it might not only be talking to you, but it'll show you the pictures as well. It will not move on to the next step until you've completed the others. When we're looking at pads, you don't have to think, where did she tell me to put it exactly? The picture of the pads always show you exactly where to put it, okay? So you just make it match your picture when you're doing this, all right? So you don't have to remember how to use that AED, okay? It is meant to be used by anyone. There are semi-automatic and automatic. And the difference is the semi-automatic means they're both going to analyze that heart rhythm and determine whether a shock is needed. The semi-automatic, which we'll train on, so you're used to that, will actually tell you to push the button, okay? The automatic will deliver the shock automatically. But the AED will not move on till it'll keep telling you over and over, you need to push the button, you need to push the button until you do that. So that's the main difference between semi-automatic and automatic, okay? They are portable, they are meant to be moved around. I will tell you, don't be afraid to open that cabinet. It doesn't call 911. I mean, it may, an alarm might start beeping at you. It's just alarm. It is, don't be scared of it. Open the cabinet, get it out, close the cabinet, it'll stop beeping. I feel like people sometimes get intimidated and they say, I can only open that cabinet if I'm a nurse or I'm a doctor. No, I give you permission to open any AED cabinet you need to get that AED out, okay? Brett gonna do it for us? Stop, Brett was moving that way. I'm like, go right here for you. So please don't be afraid to get that AED. That is what it is there for, okay? It also will only deliver that shock when it is needed. So you don't have to be worried about that, okay? We'll go through all the necessary steps, but it is not a scary thing, okay? Don't be afraid of it. There are the pads in the AED that we talked about. The pictures, the pads are up there. Okay, that needs to be attached, and that's going to analyze the rhythm, deliver the shock, right? The battery. So if you have an AED that you're maintaining at your workplace, those pads usually expire every 2 years, okay? The expiration dates will be right on there. So just make sure that you're checking those on a regular basis. Put a reminder on your calendar when you know they're going to expire on this date, okay? If you use that AED and the pads, you need to get the new ones ordered right away, okay? It is recommended to have two, but we understand that budgetary restraints may not allow you to have those two. We usually like to have one attached and your backup ready for when you use it, but get them ordered right away. Some AEDs, the newest AED on the market has a rechargeable battery. So like my son's AED that he carries in his backpack, we charge it and plug it in just like his cell phone. And the charge lasts for 7 months. So they have, some of them have a little different battery setup, but typically those batteries in devices like that need to be replaced in anywhere from 5 to 7 years usually. Okay, so they last longer than the pads. But you're looking at that device monthly to make sure it's what we call rescue ready, and it will be flashing green for you as long as the battery is still fine. If the battery starts going low, it'll let you know that, okay? It usually indicates a red X on it. That's what you're looking for. Okay, and then there's the capacitor and the processor, and that's that, you know, the engine and stuff behind those AEDs storing that energy to deliver the shocks. It is going to be evaluating and looking for 2 different shockable rhythms, right? Irregular rhythms, ventricular fibrillation and pulseless ventricular tachycardia, okay? You don't have to know any of that stuff. The machines are so smart. It is checking for that. It is looking for it, okay? There's a few things that I'll say, and I'll say, this is the one I start. If you only remember 2 things from me today, this is one of the first ones, okay? You cannot get in trouble. And you cannot make it worse. If someone's heart has stopped, you cannot get in trouble for trying to help, and you cannot make it worse. This is the law that protects you. People always ask me, well, what if I break their ribs? Everyone asks it, so I just get it out of the way up front here. You might not. It doesn't happen every time CPR is performed, but it does happen sometimes. And I can promise you, if you broke someone's ribs, saving their life, they're gonna say, thank you for breaking my ribs. Okay, ribs can heal. We're giving them the best chance of survival. So the first thing to remember, can't get in trouble and you can't make it worse. Okay. So I mentioned our AED placement program. We know that CPR is critically important, but we also know being able to respond and provide that shock to individuals in cardiac arrest is equally important. So since we started our AED placement program, we have donated over 200 AEDs throughout our state. Our goal is to get one in every single county. Now, this map does not mean that these counties don't have AEDs. They for sure do. This is just our map. We know we're trying to make sure that we're reaching the whole state. So our goal is to make sure we're donating to all of these counties. So we're targeting those counties to, so if you know people, or if this is maybe if you're from there, make sure you share that. Look at that, my county is still on there. Drives me crazy. Like, somebody please apply with AED, we will give it to you. The library, I think, just requested it for my hometown, because they also requested, we donate blood pressure devices to libraries too. So people can check those out, have access to be able to check their blood pressure. So I think I'm gonna get my county soon. So again, we want to make sure that Iowa is rescue ready, and this is part of how we do that. So what we're going to do next is we're going to watch 3D video of CPR taking place. Then we'll debrief about it. We're going to talk through what you saw. I'm going to demonstrate the techniques right here as well. And we're going to watch an AED, a 3D video of that, so you can see what's happening inside of the body when that takes place too. We'll go over, we'll recap those, and then you all get to practice and try, okay? You can ask me any questions, but we're all very visual learners. We all consume information visually now, right? It's all on our phone, we're scrolling, we're looking at it, we visually see this. And I think it's gonna help you to understand why we're looking at, when we do these, we're gonna be looking for 2 green lights. And you'll see there, the cadence, how slow or how fast you go is important. How deep you go is important. Whether you let it come up and down. If I start going too fast, right, we're going to show you what's happening inside when we go too fast or go too slow. All right, ready to check it out? I'm hoping, I think I said this before, if we have to watch an ad, please know, I don't endorse whatever ad is going to pop up. I have no idea what it's going to be. We tested out earlier and an ad did not pop up, but I'm about 50-50 for how this goes down when I'm actually doing it. So we're going to hope it's not an ad. Oh, yeah.
Our heart is an amazing organ. It works hard for us every second of every day delivering blood and oxygen to every cell in our body. But when sudden cardiac arrest strikes, our heart suddenly and unexpectedly stops beating effectively and blood flow stops. Without any intervention, the brain, vital organs, and our heart will begin to die. Beginning CPR is the person's only chance of survival. Brain damage will start to set in within 4 minutes, and after 10 minutes, brain damage becomes irreversible. The power to save a life is truly in your hands. Performing CPR accomplishes 2 critical things. 1, compressions move oxygenated blood to the brain to keep the brain alive. And 2, compressions keep blood and oxygen moving to the heart muscle itself so that it has the best chance of resuming a normal electrical rhythm after a shock is delivered. As you begin compressions, you are creating an artificial pump and doing the work of the heart manually. With each good, effective compression, you are building up pressure in the system, which will move blood around the heart and up to the brain. It does take time to get the blood moving with CPR, so it is very important to push hard and push fast to build the pressure up, which keeps blood going to the brain. Pushing down at least 2 inches allows for the heart to be squeezed and blood to move out. Pushing at a rate of 100 to 120 compressions per minute is necessary to keep blood pumping. Let's see what happens when we take our hands off the chest. Blood stops moving to the brain. It is for this reason that if you are taking your hands off the chest to deliver breaths or switching roles, it is critical to minimize time off the chest. Watch what happens when we don't push deep enough. Blood does not reach the brain. The same is true if we do not push fast enough. Watch what happens when we push too fast. The heart does not have time to refill with blood. Therefore, not enough blood gets pumped out. Watch what happens when we don't allow the body to decompress and allow the chest to fully recoil. The heart does not have a chance to refill with blood. Therefore, no blood gets pumped out. So remember, the key purpose of delivering compressions is to keep oxygenated blood moving within the heart and up to the brain to keep the brain alive. We need to push hard and push fast in the center of the chest. If ribs break, that's okay. What's not okay is allowing the brain to die from a lack of oxygen. So remember, you are their only hope. Do the best you can, and don't give up until medical help arrives or an AED is present. You can do it.
Okay, so first step, to call 911, right? We're calling and getting that emergency help on the way. If someone is available to go look for and get that AED, send them to go look for and get that AED, to start CPR right away. Okay, those compressions are important and we need to start them quickly. Now, this is the second thing that I want you to remember, if you don't remember anything else, is you're gonna keep your arms strong and straight, okay? Because if we bend our arms when we're doing the compressions, where does all of that force go? Goes back out, right? But if we keep them strong and straight and we're pushing down, where does the force and energy go? Down into your compression, okay? So if you don't remember anything else, keep those arms strong and straight. Now, on the picture, the video, you saw them with our hands like this. Your hands can be like this, they can be out. It doesn't matter how you have your fingers, whatever you're most comfortable with, okay? You're just gonna be pushing down with this heel part of your palm, not your fingertips, the strongest part of your hand, one on top of the other. Center that chest, right around that nipple line, okay? Now you will see what my man can have. Most of them that you've seen don't have breasts, do they? These are new, the female mannequins are new. Before this, I still put like breast attachment on ours. Because women receive CPR at a lesser rate than men. Women receive CPR at a lesser rate than men. So it's very important to me when I do education that I bring females and female mannequins. So that people get comfortable with this. We teach kids, we teach youth, we teach teenage boys CPR, and this is hard for them. right? It makes them uncomfortable. So we talk about, you would want your mom to be saved. You would want your sister, your grandmother to be saved. So I'm here to tell you, it is okay to touch a woman's breast to save her life. It is okay to expose a woman's chest and breast, to put those pads on her to save her life, okay? This is important for us to know, that it is okay to do this. And that is part of the hesitation though, right? That we wanna make sure that, and I love that people are respectful of women's bodies, but not at the cost of not saving their lives. Okay, so you're gonna go in the center. Typically, again, we would want them for today's class, we'll do it on the table, or if you're comfortable on the floor, we can. Typically, you're going to have them on that hard, flat surface, okay? But for today, so you can see it, I'm gonna move the mannequin back up. So you're wanting them on that hard, flat surface, so it's usually the floor, okay? You don't want them on a couch, you don't want them on a bed, because that soft surface, when you're giving those compressions, absorbs the pressure, right? You need them on that hard surface. So depending on how tall you are, it might be difficult to do these compressions on the table, okay? So just remember that, think about it. Hard and fast center of the chest, straight arms. You want your shoulders above where you're pressing, okay? Especially, you're gonna have to press harder than you think you do. So you're gonna need to be on top of this, okay? Now, you're looking at 2 green lights, I can get it fast enough, okay? 2 green lights are gonna tell you you're going deep enough or fast enough. Red light, not good, okay? You get an extra light, also not good. There are 4 lights. I'm gonna start going really fast. See the flashing yellow? Okay, that wasn't good, and it turned red. That just means I wasn't going at the right speed. Okay, so when we practice, you're going after those 2 green lights, hard and fast in the center of the chest. Now, strong is staying alive for this age group. If you happen to be a parent or grandparents, Baby Shark works too. So you're welcome, now you'll have Baby Shark. All day. You can Google CPR songs, and they just came out with a whole nother host that are at that right rhythm. When we get the AED trainer out, you're actually gonna hear, it will give you your cadence. The AED will give you a loud click to tell you exactly when to push. Okay, so it helps give you that. So again, fingers can go any way you want, on top of those, shoulders above it, and you're pressing deeper than you think you're gonna have to, okay? This is, I've been told by cardiologists, this is about the resistance you're gonna feel, so you can understand this is harder than you think you have to push, okay? We are focusing on adults for this hands only. I'm gonna show you quickly the compression technique for infants, but for those babies and infants, we really do need those rescue breaths too, okay? So please know that I am just showing the compressions so you know that you're not putting both strong hands on the baby, okay? For the compressions on an infant, you're going in the center of the chest and you're doing 2 thumbs, okay? To get those 2 lights. All right, or you can do the 2 fingers. I happen to prefer the 2 thumbs, just feels like it's more secure for me. I don't know, I don't have super long nails, but I'm not as comfortable with that. I like to do the 2 thumbs, okay? That's for infant. For a child, you're doing 1 strong arm, and those teens and adults are doing the 2 strong arms, okay? I'm talking too long, guys. Thought I turned my time now on that off. Okay. So next, we're gonna watch the 3D AED demonstration of what's happening. We'll show you the pads, where they go, how to put them on, and then we're gonna get up and get to practicing. Sound good? I can't be so lucky to not get an ad again, but we'll see. It might just be my day.
Video is intended to help you understand how an AED works. The ECG strip you are going to see is from Steve's actual save, a real person who is alive today because of an AED and some good Samaritans who took action. Once you turn on an AED, the machine will begin to speak to you. Follow the voice prompts. Once the pads have been placed, the AED will instruct you to stand clear and to not touch the patient while it does an ECG of the heart. The AED is designed to determine if the heart is in a normal rhythm or if it needs to be shocked. In this case, the heart is in ventricular fibrillation, the most common rhythm when someone goes into sudden cardiac arrest. Notice how the heart is not beating effectively. It has electrical activity, but it is uncoordinated. the heart looks like it is shaking like a bowl of jelly. When in this rhythm, you can see the heart is not effectively pumping any blood out. This rhythm is deadly and has to be stopped. When the AED reads a shockable rhythm, the AED will either instruct you to press the shock button, or some AEDs are automatic and will automatically shock the person. At this point, no one should be touching the patient. The AED will send an electrical current through the heart and back again. The purpose of this shock is to stop the heart completely for a very short period of time from this uncoordinated rhythm and give it time to reset. Notice how the shock stopped all the electrical activity in Steve's heart for a brief period. Seconds after this shock, our own SA node, the pacemaker of our heart, will try to regain control of the heart and tell the rest of the heart when to squeeze. It can take up to 2 minutes for the heart to reorganize itself electrically after a shock, before it will function again and effectively pump blood to the brain. This is why you will be instructed to begin CPR immediately after the shock. Your job is to push hard and fast in the center of the chest in order to manually pump blood to the brain to keep the brain alive. Your compressions will not interfere with the heart trying to reorganize itself electrically, so do not worry about that. After 2 minutes, the AED will instruct you to stop CPR. It will reanalyze the heart and advise whether another shock is needed. Always listen to the machine and follow the voice prompts. In Steve's case, the ECG picked up a healthy rhythm, and therefore a second shock was not advised. In Steve's case, only one shock was required to bring him back to life. Steve's heart continues to beat, and he is alive and with us today.
So was there something that surprised you about that you've maybe never heard?
It stops their heart.
And it stops the heart. That is the number one thing that people don't realize. It is shocking you to get that heart out of the bad rhythm so it can get itself back into its normal rhythm. Okay, so that is why those compressions are important, right? So we're going to keep pumping while the heart's reorganizing itself. Sometimes it does take more than one shock. Steve did not, but you'll continue through that, obviously, until help arrives. You're just going to keep doing the CPR until that individual becomes responsive or help arrives. Okay, that's how you know when to stop CPR. That individual becomes responsive or help arrives. It will tell you, and it'll just keep reanalyzing. Okay, so let's go through pad placement. So I'm going to show you on infants where it goes. Now, most of your AEDs now have what's called universal pads. They used to have pediatric pads and adult pads. But we obviously, when we know better, we do better. We realize that switching out the pad types takes time as well. So most of the AEDs have the same universal pad. The AED will just have what's called a child mode, okay? So the AED might ask you to push a button that says child, or here there's a picture of one on mine, okay? So in an infant, we're gonna take this pad, we're gonna look at the picture, and it is right in the center of the chest, okay? So we're putting that pad in the center. Now, the picture of this one shows it in the center of the back, okay? So for the infants, it is like that because the two pads cannot be touching. Okay, so it's going to take a shock that's going from one path to the other through the heart. So we need the pads in the front and the back because they cannot be touching because it's not going to be able to analyze the rhythm correctly. Okay, so that's why that. If the child is big enough that you can get it as they grow older on this part and on this part, just like on the adults without it touching, that's okay. All right. But these wires are going to be touching. This one's not even fully on, so you see this, it doesn't fit, okay? So it fits properly to be all the way on. It's in the center and the back. Okay, so that's the difference between infants, and then as they get older, you're going to match them with the adult pictures. Okay. So on those adults, again, here, okay, we're going to find this picture. You don't have to remember, is it the left, is it the right? Just make it look just like what you see, okay? It will be a stressful situation, so try not to worry about, what did she say? Just match the pictures, okay? We're really visual. This one, okay, it's pictured down here, so I'm gonna put it down here, okay? Then that shock's gonna go through there to the heart. You don't want it high up on the neck. You don't want it down towards the belly button, right? You want it right there. Center where the picture shows you. Make sense? Now, you saw in the video they were cutting the clothes. There are AEDs that have the kit with them that has the scissors, okay? Some of them do not. So if it's a zip up, unzip it, get to that, it has to be on the bare skin, okay? If you need to unbutton, however you can get to that, move it up out of the way. Those bras, up and out of the way. If you don't have the scissors to cut them, get those out of the way so you can get to the skin, okay? All right, we want that bra out of the way and wire out of the way. It needs to be dry skin. So if it's at a pool or somewhere else, try to dry it as much as possible. If it is a hairy chest, if there's a razor available, the kids, if they have scissors, they usually have a razor as well. You may have to shave part of that hair off to get the pad to stick, okay? These are just some situations I'm telling you about that might come up. Make sure the skin is dry and that it's sticking to that skin, okay? If you don't have a razor and it's hairy, just do the best you possibly can, okay? Do the best you can with the tools that you have available. Right? Okay, so let's turn this on so you can hear what's happening.
Adult patient. If the patient is a child, press the child button.
So that's gonna be that child button right here on mine,
Loading from the patient's chest.
telling you everything to do.
Remove packet and apply pads on the patient or skin. Apply pads and press pads firmly on skin. Apply pads as shown in the picture. Press pads firmly on skin.
It's gonna tell me that, but I make sure I got the sensors
Do
down.
not touch the patient. Analyzing heart rhythm.
So you're listening to it and doing what it says.
Do not touch the patient.
You don't wanna touch it.
Heart
It'll be
rhythm.
analyzing yours too,
Shock
potentially.
advised. Do not touch the patient. Everyone clear. Press the flashing shock button.
So this is that semi-automatic that I talked
Press
about.
the shock button.
It's going to keep telling you to press it. Well, you
Press the
do.
Shock button.
Okay.
Shock delivered. Begin CPR.
Hear that? That's telling me my rhythm.
10,
And it's gonna count
20,
up to 30, okay? Now, if you're doing rescue breaths or comfortable,
give 2,
that's when you do the rescue breaths. If you're not comfortable doing the breaths, you don't stop. You just keep doing compressions, okay? Don't do 30, 2, 30, 2, 30. It's gonna
20,
get you all the way to that 2 minutes until it reanalyzes the rhythm. Okay,
30, give 2 breath.
questions about this?
So if you have like a child that's maybe like 8 or 9 or
Oh,
something.
yeah. Thank you for this. I wasn't very specific on, so those universal pads and the child mode. A child is defined by 55 pounds or less, or usually 8 or under. Now, here's the deal. You're gonna have maybe no idea how old this child is potentially, or how much they weigh. Okay, now an infant, you're gonna know. Toddler, you're gonna know. When they get up to that questionable part, if you're not for sure, don't press the child mode. You would rather give more of a shock than not enough. And when you think they might be 8, they might be 9, they may be 60 pounds, but maybe they're only 50. If you're not sure, you don't have to press the child mode. That infant and toddler, you're gonna press that child button, okay? Thank you. for
So
that
kind of like
question.
if they're big enough that you can actually separate then they're probably that you lean more toward using the adult. But I mean, would you put them both on the chest and still use the child mode?
Potentially.
Yep.
Potentially. I mean, you think about those, they could be a thin, still have a big enough frame, but thin little kiddo, and they're not gonna be 55 pounds yet. Again, do your best guess. And you'd rather have more of a shock than not enough. Okay. All right, so, just because I want to get people to practice the compressions, we're going to go over a couple of resources for you as well. Do any of you know if you have pages on the next screen, and we'll email this presentation, that have the checklist for you, all that good stuff. So you're going to want that cardiac emergency response plan to think about the AEDs, where they're at, how many do you have? Now, because that brain damage can set in within 4 minutes, you really want to cover a building or campus, you want them within 4 minutes of any location, okay? There are organizations that can help you walk through and assess that, okay? So you want make sure that you have enough AEDs, make sure that they're clearly marked and publicly available. Sometimes I go into organizations and they're in like the staff break room. Well, the public doesn't have access to those, right? So we need to think about making sure that there's access to those AEDs if they're available. And when we've had organizations go in and the practice with the schools, right? And they do all this, they have their team, they have their plan, they've done the training with the staff, and then they go to do their drill. And guess what? Schools are always locked now. So they called 911, they had worked with their local EMS to do the drill, and EMS arrives, and guess what? They couldn't get in the building. They forgot that as a part of it, right? Like, who's gonna go open the door? Who's gonna let help in? So that's why drills are important. Another school identified that they had an elevator to get a stretcher up to the second floor, but the elevator was too small. It didn't fit in there. So there's just things you learn by doing drills and knowing that you're prepared for that, okay? So the organization that we partner with in Iowa here is called Project Adam, and they go in and help make organizations and schools classify them as heart safe. And they've got entire complete checklists that have all the details, what you need to have in it, components. So that's the organization, again, that we partner with for that cardiac emergency response plan and what your checklist is, who needs to be a part of it. So those are all available, and I'll make sure that Brett has those too, the link directly to them for you guys. Okay. All right, who's ready to practice? There's gonna be no rhyme or reason. You guys are all just gonna come up and practice on any of the mannequins. After you practice, you're welcome to fill out the back of that sheet, the after. I will be here just walking around, answering questions, helping to look at your technique. But that really concludes my formal slides for you today. I'm so happy that you're here. I'm happy that you're taking the steps to make sure that you know this either for the first time or you're reimagining what CPR looks like for you in your life and organization. So thanks for being here. Come on up and practice, and grab me if you need. I'm going to leave these up here while we're doing the practice in case you need that. My email will be at the end. My cards are up front if you want to grab them. But yeah, let's go put some of these things we just learned to practice.
Thank you. And before you guys leave, when you're done with your training, if you can fill out our feedback slip as well about today's program and any ideas or interests that you would have to see for future lunch learn, we'd appreciate that as well. So thank you.
Yeah, it's automatically on. As soon as you start pressing, it's gonna come up. You know, with those lights, no matter what, there's no on or off. You got this. Yeah, however you're comfortable, keep those arms nice and strong and straight, okay? And then lean over and hard. Yes. Yeah. Yeah. Like, it'll be on that top, it'll be on the shoulder right up there. You have to lean over, it'll start. Perfect. You have to push harder than you think, don't you? Yeah. You get tired fast. Yeah. That's why it's so important to call 911 right away. Just a little too fast. That's why you get that extra one. There we go. So that's why sometimes we get this adrenaline going, right? It's always important to remember it. Yeah. You can start feeling that rhythm. Go harder. Yeah, you're doing great. It's good. Yes. Harder. Hey, we're putting on there.
I know, I'm trying to figure out, is it
We're
too high or?
on the floor? Yes, it's hard.
I
did your tiptoes. Yeah.
The width.
Yeah.
I did that, and I got too green.
Yeah, that tells you you're going the right speed and the right rhythm. You can definitely practice placing the pads if you want and listening to what that AED does.
Geez.
The better.
Yes.
Easier to get your lights.
In
You know, it's
How do
hard.
you know?
I
I suppose something's better than nothing.
Yeah.
It's talenting.
Yeah.
Yeah, you're welcome to practice on the inside as well and I practice fixing. And then we've got another one over here too.
Adult patient. If the patient is a child,
That's like-
press the child. Do not touch patient analyzing heart rhythm.
There you go.
Do not touch patient analyzing
Oh, okay.
Right.
Everyone.
Okay, put on. Okay.
Shot, deliver.
Feels like pretty push.
Uploaded right there.
Leave the pads on.
Oh,
Okay, leave the pads on, yes.
Not like these.
Once you put those pads on, you leave them on, okay? Leave them on until emergency help arrives. Even if the individual becomes responsive, please ask them to leave those on. Don't pull them off, tell them not to pull them off, because there is a chance they will get out of rhythm again. You just keep those pads on always, okay?
No, they're gonna move, the body's gonna, they're gonna move with when they get shocked, aren't they?
Not necessarily. It's not like what you see on TV, like the big, no, not necessarily.
What does that mean? It's
Oh, it's counting, remember, it will count you up to 30.
Right.
And if you want and are comfortable and knowledgeable and want to do those rescue breaths, you can, otherwise just keep going through till it counts. And then you just keep going until it says to, have your hands off, so it can, analyze the heart rhythm again, okay?
okay.
One.
I'm sorry.
How do you turn that off? Someone can.
Oh, yeah, we'll just turn it all the way up. Until
Just two.
yep, they're gonna be right up here, you're gonna trust harder than you think, there, harder.
Yeah, yeah.
You gotta trust way harder than you think.
I got it.
And it's okay, like, great, don't you think you can put them down? Fine, cause it's easier, there you go. Alright, just do it. Yeah, you just have to hold the one button, okay, that one's hold, and sometimes if it,
Adult
yeah,
patient.
there you go, so you, okay,
If the patient is a child, press the child button.
one of it is.
Remove. Press pads firmly on skin.
Yeah.
Yep. Thanks for doing.
Is this
That's black, it's about over here. Yeah, look, yep, that's why.
Do not touch the patient analyzing heart rhythm. Do not touch the patient analyzing heart rhythm. Just advise. Do not touch the patient. Everyone clear. Press the flashing shot. Deliver.
Yeah. It's why it's good, you have to press way harder than you think, I'm like.
So I'm here because my father has
That's
heart
hard.
disease.
There
So
you go.
how expensive are these for home?
Oh, so the question was, you know, how expensive is a home AED? So typically they range from 1,500 up to 2,000.
Right.
There is a couple of them potentially, like mine, I don't know if they still have as an option, but like we lease the one for my son and it's $350 for the whole year.
Okay.
Now my son's
Okay.
also is covered by our health insurance. So he has a prescription for an AED. So the
That's
very
another
first,
question I was
yeah,
gonna
the very
ask.
first one that we got, insurance paid for all of it. But we've had it for so many years that we needed a new one and the leasing option was just, we wanted to do this one because it is smaller. It's only a little over 2 pounds. It's the newest FDA approved one, so it's really small because we knew he was gonna be in middle school at that point and he was gonna need to carry it around with him because Iowa buses don't have AEDs. Teachers actually are not required to have CPR training in Iowa either.
That makes no sense.
I know, yeah. So we were trying to keep him as safe as possible. So we knew he was gonna have to carry an AED with him. So that's why we went with this particular one.
Okay.
But yeah, the insurance may cover it depending on what, you know, heart disease or condition they have. Now, they don't cover it just for general heart disease. But his is specifically a heart rhythm issue, so it puts him at risk for cardiac arrest. So insurance may cover it. If not, you can purchase them for, you know, yourself as well. If you're interested in wanting to purchase one, feel free to take my card and I can connect you with the individuals that we work with to get you the best price possible.
Oh, okay.
They're just really good about trying to give anybody that we refer them to, the best price for that. If you want one for home AED use, yeah. And they usually run, the warranty lasts usually anywhere from 5 on the low and 5 years, usually all the way up to 20 years on the warranty side, and then 8 to 10 years usually. Over the course of that time.
Remove packet.
For us, it's
Slide
worth it,
pad
right?
on
We don't want to hire.
skin.
But yeah, feel free to take my card and ask me those questions. Okay.
All right, thank you.
Thank you. Of course, thank you.
Apply pad as shown in the pictures. Fly pad.
It's because not saying that it's.
Yeah.
That's true.
Yep. Go ahead.
Yeah.
Do not.
It's telling you to put pads in there, because it wasn't, they weren't all the way pushed down.
Analyze.
So we had an instance here where it kept saying over and over again, put the pads on the patient. It's because the pads, they weren't quite as sticky because we've been using them a lot today, and it wasn't stuck on there. So if it keeps telling you to put the pads on there and they're still on there, then just make sure you push them really good and make sure that way they're on and it can sense it. It's telling you that it can't sense that that pad is on there, right? Yeah, same thing. You want two green ones, just like if it's there. Okay, you're good. That's just the one. Okay. That little one. And then if you get that extra or if you're going too fast, and when you get that red one, that means there. Yellow, it's too fast. See, that's extra one, that's too fast. If you get a red, it means that you weren't going deep enough or you started going too slow. Oh, that was it. Go down just a little. There you go. I can only tell that because I just do this so much.
Yeah,
You know, I'm like, nope, I'm getting too fast.
Yes. Instant feedback.
Yes, it is that instant feedback. You get a sense of that feel, right?
I like the instant feedback.
It's different from when I took it.
Yeah, and the only thing to remember on that is that, right, always have it even on the side when you're practicing, because obviously their legs will be there, so your hands were positioned differently. Well, your hands were positioned differently here, because you were standing like this. But the body's always you're always gonna be at their side, because they will typically have legs, right? And here, so you don't wanna be on top of that, so that's why
Jack.
adjusting your hands that way. Yeah. Okay, get the power of their control for us. Yeah. I'm gonna try on the floor. I'm gonna try on the floor, if you don't mind. And try, if you use that, it hopefully will not, on the floor should be better, and you just keep arms strong and straight, use the force out of your shoulder. So you're not having to hopefully use your wrist quite as much. Okay, yeah, better.
30, give 2 breath.
Yeah, just use as much of that body weight, like you may even need to, come and use your body weight on that. So then you don't have to put as much force out of just your wrist, okay? Use those shoulders, the
Analyze.
stronger and straighter that is, the better off you will be too, okay?
Do not touch the patient.
Yeah, it doesn't help, I also.
Everyone here.
Well,
Flashing shot.
but now you see, like, it's possible, you can do it,
Right, the shot.
and just make sure you get them on that hard surface for you. And then leverage your weight right over where you put it down. That will help you, okay? I have to, yeah, you're good.
Jack.
Sometimes it's because we were doing it so much, I would press right here over a little bit. Sometimes my sensor, after we all press on it a lot, I gotta readjust it. There we go. Oh, yeah, feel the difference, feel the clicking now. Yeah, sometimes my sensor shifts after we do a lot of people on the chest there. There you go. Yeah, it is easier on the floor, for sure.
Bennett.
But it is, it's exhausting, right? So if you've got help, it's okay to switch out. Medical personnel typically switch out every 2 minutes, okay? So I mean, it's physically demanding to do CPR. What we don't want, and I probably should, I shared this too, I'll try to reinforce it other times. Is that if you get to the place where you're feeling like you're just exhausted and you can't do it anymore, that's okay. We don't want a second victim, okay? I had an older woman that asked me one time, how long do I go? I said, until help arrives or till you just physically can't anymore, and that's okay. And you can almost feel like a whole sense of relief come over her because she had tried to give CPR to her husband. And she just couldn't anymore, and she was not able to save him. And I said, you did everything you possibly could have. There is nothing that you did wrong, not at all. So again, you just do what you can. You can't get in trouble, you can't make it worse.
50% more dead than dead.
Right, exactly. You just try. You just try until you. So, thank you guys so much for being here. Thank you.
Do you need help carrying anything out, Leslie, or you good, or?
for helping. It'll be okay. I mean, I just bundle them up like I do grocery bags. I'm like. But I appreciate that. I'll get them loaded up here.
Thank you so much.
Well, thank you.